Let's talk about the definition of strain counterstrain. What is strain counterstrain definition? Well, counterstrain, it's an American osteopathic manual medicine procedure. It's an indirect and neurological approach. It's a passive and specific shortening position which places the body in a situation of great comfort, decreasing pain and dysfunction. In this way, it stops and reprograms the incorrect multisystemic neurological activity that keeps the dysfunction active. So let me chop down this definition for you so to make it more feasible. Well, counterstrain was born in the American osteopathic medicine, so it's a scientific approach. It's an indirect and neurological procedure. What does indirect means? Well, in manual medicine, we can have two big approaches upon a dysfunction. Let's say a joint is blocked out of place. A direct technique will perform a situation where it will try to take this joint back to its place. So it's going to push it back to its original position. Well, instead, an indirect technique means what? That if the joint is out of place, we will not try to push it back, but we will try to do something to release the tension that is keeping this joint out of place. So we will take it more into dysfunction, more out of place. When this reflex, when this situation of abnormality is resolved, the joint will go back to its original position. And how this is performed? It's performed in this way. It's a passive and specific shortening position. As we can see in this old picture, and I've chosen this old picture on purpose, because I could have put a bright color picture, but I wanted to show you that while here in Europe, counterstrain is still an innovative and fresh technique, in United States, people were performing this technique since the late 60s. And we can see here Ed, our colleague, is holding up the head of this patient, and the patient is completely passive. What is Ed doing? Ed is shortening the area of the muscle in front of the body of the patient. But it's not only passive shortening the body. He's doing it in a correct and specific way. Because when he's shortening the muscle, Ed is even monitoring something that will tell him, under his finger, the tension, will tell him how much flexion or rotation or other components is needed to relax this dysfunction. This is why we call it a passive specific shortening position. Well, what happens when we passive and specific shortening a body segment? Well, this situation always places the body in great comfort. And this is why when we are in pain, let's say we have a pain in our shoulder, we will not keep our arm here. We will keep it near our body to protect it, to nourish it, and even to limit the body movement, because we know that when we will move the segment, we will feel pain. So every time the body is in pain, it always tries to shorten the position. And that is what we call an antalgic position. Why is this? Because when we have pain, if we stretch the segment, we will make the nociceptor burst into fire to our column, and we will feel pain. Instead, if we close, we shorten, we pack up the area that is in dysfunction, the nociceptor will lower their frequency. So this is why normally the body tries to achieve this situation, this position. And in counterstrain, we do exactly what the body needs. We try to find this comfort position, this antalgic position. But it's not only a shortening, as we all do when we are in pain. It's a specific shortening. It's a major shortening that the body naturally will not do this. So we'll do this and we over-shorten the position. And by over-shortening the segment, we not only decrease pain, but we even decrease the dysfunction. And in this way, keeping it a certain amount of time that we will see afterwards, it not only stops the pain, but it reprograms the incorrect multisystemic neurological activity that is keeping the dysfunction active. So when we shorten, we will switch off this neurological wrong reflex, and we will regain the normal situation and activity of that body segment.